A new, more infectious variant of coronavirus is causing an avalanche of cases in the United Kingdom. The country has recorded 250,000 new infections in just the past 5 days. Hospitalizations are now higher than the peak of the first wave in April. Some hospitals in London have reached capacity and patients are being sent as far away as Cambridge. Doctors are warning that in the coming week, the hospital crisis is likely to get much worse. Let's get some more insight on this from Dr. Bharat Pankania. He's a senior clinical lecturer at the University of Exeter's Medical School. He joins me now from Bath in the UK. Doctor, always good to speak to you. Thank you for your time. Now, this new strain was first identified in September. So are these rising daily numbers we're seeing in the UK mostly due to the new strain, or is there another factor at play here?
I think there are a couple of factors at play here, and certainly, whilst the strain, the new lineage, may be more infectious, the more important key point also is we've entered the winter months, so we are more indoors and we've been interacting more with other people. So you have your crowded offices, restaurants, buses, transports, shopping for Christmas, and all of those things add up to sowing the seeds of a rise in number of cases, which is what we are seeing now.
Doctor, if these figures continue to go up, will the NHS actually be able to cope?
Well, the NHS right now, unfortunately, is at its maximum capacity. And as you reported, we are having to transport patients from a high number of cases to other parts of the country just to look after them. This is a very critical situation. What we hope is that maybe with restrictions in movements and people staying at home, we can stabilize and not generate any more cases. My concerns are, as a result of Christmas, the next 2 to 3 weeks in January are very critical, and I hope the case numbers don't keep on rising as they are.
And that's a hope that most people will have. But at the same time, the UK has actually started its vaccination program. You tweeted recently, though, that the supply chain is not as good as it could be. So how long before we actually see the effects of this vaccination program, especially if the supply chain is not where it should be at this point?
So what it is whilst the number of vaccines have been promised, it is not an easy matter to deliver them in bulk to the people to get immunized, and therefore it slows down your mass immunization program because you've got a supply coming in, but you haven't got a huge supply coming in all at once. So when you start immunizing, and if you start at 1 million per week, that takes you 50 weeks. What we want to really aim for is do 2 million a week, but the trouble is I haven't got 2 million vaccines to give in a week. And that's the issue. Once we are able to secure a larger supply, it will become easier to immunize a large number of people and then start seeing the results. And if we do the large immunizing campaign, it will take up to beyond March, April to have a sufficient proportion of the population immunized so that we feel the case numbers are now coming down.
You know, there's still many who are skeptical about this vaccine, not just in the UK, but in many countries around the world. So how do governments build trust in the vaccine and to hope that more people will actually be willing to take it?
Yes, this is very important, and this is the sort of work I have done for over 20 years, which is you need credible, respected healthcare subject matter experts to lead on this and to gently, carefully, honestly explain how well the vaccines work, address the safety fears, and take the people with you. You can't force people to have the vaccine, but what you can do is reassure them, explain to them how it works, and address any concerns that they may have, and hopefully you will convince most people. You will never convince all people to take the vaccine.
Dr. Bharat Pankania, always good to get your analysis. Thank you so much for joining us.